everyone. It's Dr. Morales and Linda.
Hey guys.
Right. So we're gonna take a few minutes during this, downtime with the pandemic, quarantine, and we're gonna continue our series of educational topics in plastic surgery. So I've gotten a couple of requests actually from social media, and that's pretty much the same question. So I'm gonna talk about that one first, and that is, when is the best time to have plastic surgery after massive weight loss? And we are seeing this more and more in society with, massive weight loss surgery, right?
Mm-hmm.
So this is one of the results that happen when you lose a lot of weight. Inevitably, you're going to have all this extra skin on your body. And some people are able to kind of shrink back down, some people are not. Stretched out skin, stretch marks, lose skin on your arms, thighs, abdomen, affects the breast, even for men too. So there's a tremendous amount of deflational kind of skin that needs to really be removed. There's no laser, there's no cream.
We get that a lot too.
There's nothing of magic, magic non-surgical procedure that's going to automatically tighten your skin back to what it should look like. It just comes down to physically removing. At this time in plastic surgery, the answer is we have to cut it off. So it's really become like a fancy tailor. And it's addressed differently in different parts of the body. The scars are ideally placed in areas that are, we try to conceal these scars in well-concealed areas of clothing typically, and contours of the arms or thighs. But this new advent of massive weight loss surgery with gastric banding, and they had the bypass before that, you're going to lose a lot of weight really, really quickly.
Yeah, absolutely.
You've heard these stories, right?
All the time. People call, and even doing it just naturally. Some people have done it, a lot of people that we know have done it naturally. And it's taken them years, and so they don't realize they feel better, they look better in their clothes, but once they realize the amount of weight they lost, and they're like, oh my gosh, under my clothes there's another me.
Right.
There's another me under there,
Yeah.
and it's all skin, basically all skin.
Yeah, and so I would say the gastric surgery is the end result's the same. If you do it, I'm not gonna say the right way. I've gotten in trouble saying that, but it's just harder. It takes longer, right, to do it. With diet and exercise, it just takes years depending on how much weight you're gonna lose.
Mm-hmm.
Gastric surgery, you're gonna lose, depending on your size, you may lose 50 to 100 pounds fairly quickly. It's pretty impressive, and it goes quick, and it has to be managed appropriately by your gastric surgeon. So they're watching your health and your nutrition, because there are some nutritional deficiencies associated to these gastric surgeries. And this gastric surgery is not immune to having complications. You can have complications from the inside. That's abdominal surgery. You can have problems in there that can happen. So before you jump the gun and say, well, I'm gonna lose 100 pounds and I'm gonna go get a gastric band. Yeah, go talk about it. Go learn about it. There are risks to surgery, and I'm not immune to complications or risks. I'm a plastic surgeon, but it's surgery. Surgery is surgery, and every surgeon have issues with risks and complications. And we, as surgeons, I try to decrease those risks. Okay, but the end result with either you lose it with gastric surgery or diet and exercise is you're gonna have all the skin. We gotta take it off. When is the right time? When do you tell them the right time is?
The right time is when you're done losing weight.
Yes.
Right? Yes.
Says this almost every day, it seems like.
Yeah.
And I say the same thing when they come and talk to me. It's really when you're done losing weight and you're happy with your body weight, and you feel like I'm at a point now in my work life, my personal life, I'm just done losing more weight. And I can't tell you when that is. It's a you thing. You tell me when you're ready, and your weight is stable, right?
Mm-hmm.
Stable is a key word.
Sustain, weight that you can sustain for the rest of your life.
Exactly. So, and that's when you want to start thinking about having cosmetic surgery to reduce all the extra skin, and that way you can maintain the results longer.
That's right.
And you'll be happier longer with the result.
Absolutely, it's an investment, you guys. This is an investment.
So take the time in preparing for that. It's a journey. I'll be a small part of that journey, but it's really a you thing. You find a weight that you're happy with, and once you get to contour surgery, you'll be able to wear clothes that you haven't been able to wear before, feel better, maybe in a swimsuit. You won't have any rashes from extra skin, stuff like that. So, most patients who go through the contouring surgery are very, they wish they had done it sooner, and enjoy it sooner. I think that's pretty consistent.
Very consistent. And what I hear lies, I should have done this a long time ago. I don't know why I was so scared and why I was waiting. And medicine has come a long way from back in the day when they used to do these mommy makeovers. Now we have great medicine that will get you through it. like you always say, these mommy makeovers, the first week is the hardest. Once you get through that first week, you're good. You know, most patients, that's what we hear from most patients.
Yeah. So that's the answer to when you want to get, cosmetic contouring surgery after massive weight loss. Hope you learned something. Thanks for following.